This video demonstrates the use of the EZ-IO device. Battles practitioners use three sites for interosseous access. In order, they are anterior-medial aspects of the proximal tibia using the EZ-IO, the sternum using the FAST, and the proximal head of the humerus using the EZ-IO. The equipment required is as follows: an EZ-IO driver, an appropriately sized needle, extension tubing, a 10mm syringe, a 3-way tap, and a 50mm syringe. To locate the anterior-medial aspect of the tibia, measure 2 fingers width down from the tibial tuberosity and 2 fingers medially. For pediatrics, measure 1 finger down and 1 finger medially. To locate the proximal head of the humerus, place the casualty's hand over the abdomen. This will lead to the elbow being adducted and the humerus being internally rotated. Place your palm on the casualty's shoulder anteriorly. The area that feels like a ball under your palm is the target area. The needles used with the EZ-IO device are pink, blue, yellow, and red, which is for training only. The 3-way tap is constructed with 3 ports and a tap which has 3 open settings and 1 closed. This allows the caregiver to control the flow and the direction of the fluid through the device. As seen here, the tap rotates a full 360 degrees. The 3 ends that are longer are open and the flat end is closed. When the tap is set to 45 degrees to the port, the device is closed in all directions. Prior to connecting the extension to the 3-way tap, lock the white clip on the extension tubing. Connect the extension to the 3-way tap by placing the blue cap into the port, which is a Luer lock cover. Twist the cover to secure the extension in place. Attach the fluid via a giving set to one of the remaining ports on the 3-way tap. Usually, but not necessarily, the port opposite the extension. To prime the system, open the white clip on the extension and set the 3-way tap so only the ports to the giving set and extension are open. Unlock the giving set and allow the fluids seen here in green to flow through the complete assembly, including the extension tubing. Lock the white clip on the extension and close the giving set. To prepare a flush, connect a 10mm syringe to the remaining port on the 3-way tap. Set the 3-way tap so that the ports to the giving set and the 10mm syringe are the only ones open. Unlock the giving set and draw up 10 mL of saline into the syringe. Close the giving set and turn the tap so all ports on the 3-way tap are now closed. Where possible, brief your casualty and obtain consent. At the selected site, check for any evidence of injury that might contraindicate the use of an IO device. Measure to locate your selected site and clean the area. Control the casualty's movement during the insertion. Using an appropriately sized needle attached to the driver, push the needle through the skin until it contacts bone, ensuring at least one black line is still visible above the skin prior to drilling. If a black line is not visible, you'll need to change your selection of needle, for a larger size, as the one currently being used is not large enough to enter the medullary cavity. Begin driving the needle while applying steady downward pressure at the correct angle for your selected site until you feel a give. Once seated correctly, unscrew the introducer and dispose of it as a sharp. Connect the primed extension set to the EZ-IO catheter. Open the white extension clip and set the three-way tap so only the ports to the patient and the syringe are open. Attempt to aspirate a small amount of marrow with your 10mm syringe already attached to the three-way tap to confirm location. Once the location has been confirmed, rapidly flush with a 10mm syringe of saline to cavitate the bone. Turn the tap so all the ports on the three-way tap are closed and exchange the 10mm syringe with a 50mm syringe. Set the three-way tap so the ports to the giving set and the 50mm syringe are the only ones open. Draw up 50ml of saline. The three-way tap now needs to be set so the ports to the casualty and the 50ml syringe are the only ones open to allow you to administer the 50ml of saline. This should be repeated a further 4 times to achieve 250ml fluid bolus. Once the 250ml has been administered, reassess the radial pulse. Should the radial pulse still not be present, administer a further 250ml fluid bolus and reassess.